Hello my friend supporter, welcome to medical science classes. Student of medical science, I want to take the advance of medical science. What can you think say with the knowledge education? There is as a student of medical science, what is science? Science is anything that we can do the what is medical science? Medical science is the branch of science discovered by adaptation by a scientific name of human. Now my focus of the medical science class. In medical science, I learn medical science because medical science. And those are patient. Those are my patient. How much patient? Ya Ali Kram Naman, Ya Allah Shafi Kram, Ya Allah Kram. Ana Abdul Muhammad Shulma Shafi Nabi Kram. Direct Allah Muhammad Rasulullah wa Now my friend supporter. Medical science class. In case of diabetes patient, how cure you diabetes? If you identify first identify this diabetes patient, what happened to diabetes patient? In case of pancreas, there is a hormone. What happens? Insulin, glucagon, secretion from pancreas. Insulin, what happens? Reduce the blood glucose. Glucagon, what happens? Increase the blood glucose level. If you how much you eat, that much convert to how much you eat, that much convert to glucose. For simply understanding. In case of liver. And storage as a liver glycogen. If you more food eat, storage as a glycogen. When necessary, when even fasting or not take food, then glycogen break down to glucose. And in case of cell fuel, glucose plus oxygen equal to ATP as per medical science. Adenocyte phosphate, that is the fuel of the cell. And if glucose level is reduced, what happens? Why patient die in diabetes? If glucose level reduced to 5, when reduced to 5, you take a sweet or glass of sweet or glass of sugar water. Reduce 5, get correct. If instant correct, then take one packet of glucose. Correct? For adult. If glucose is equal more or less 10, and then what happens? Your treatment is reduce the glucose. How you reduce the glucose? There is a pancreas cell. In pancreas cell, glucagon increase, hormone glucagon increase blood glucose. Either reduce the glucagon blocker or not. Insulin reduce the blood glucose, increase the insulin secretion. There is a drug sensitive, increase the glucose sensitive neuron or reduce the glucagon secretion. Glucagon and hormone increase to blood glucose level. How increase? In liver storage glycogen, that breakdown. But if you not take food, how blood and in liver there is not glycogen storage, then cell, if glucose level reduce, then cell fuel reduce, cell not work properly. And if you not take glucose, then what about? As every organ made up of cell, like heart, lung, liver, kidney, and main organ heart and brain. In case of brain is dangerous. If reduce blood glucose level, blood already cell. In case of reduced blood glucose level, then nerve cell not fuel, not work properly, headache, dizziness, also heart cell not work properly. That is the policy. In case of blood glucose reduce, you feel the whole body abnormality. What abnormality? Like headache, like chest pain, like other pain. Fine. How you correct that? If reduce blood glucose, go to the below 5, then take a sweet or glass of water with milk with sugar. In case of sugar contains sucrose, fructose, that is 1 teaspoon or half teaspoon, 1 teaspoon or 1 teaspoon. And after taking a spoon, how much glucose correct, you check that. If go to the more than 10, do not take the sweet. Fine. And in case of diabetic patient, if your blood glucose is reduced to 5, reduce 5 milligram per dl or millimole per liter. Milligram. See the book. And reduce 5 in diabetic test. Then you take a sweet, and then after take sweet 30 minutes you take the how much is sweet, increase blood glucose. If equal more or less 10, then reduce food intake when until come to 8 to 7. When come 8 to 7, the normal eating process. How much you eat, everything balanced diet, there is a balanced diet. How much you eat, that much eat. And sugar, take sugar free food. By that sugar free food, if you balance diet, you control your diabetes. But when you wanted to meet, you wanted to eat sweet or more other food, you do gym or exercise. If you do exercise, blood glucose levels reduce. When reduced to 5, you take sweet. By that policy, simple policy. And a glass of sugar water, also sweet. You like sweet, you take exercise doing. Your blood glucose now when you taste 5 come, take a sweet, just like that. If blood glucose equal to more or less 10, then not take sweet, not take your balanced diet, not take, remain fasting. How much fasting? 1 hour, 2 hour, 3 hour, 4 hour fasting. By that policy you can, without pancreas, you can remain without pancreas. If pancreas necrosis not present, and if pancreas is not necrosis or not present, or surgery of the pancreas cut down, you can remain without pancreas. Now, how you understand you have diabetes or not? The symptom is the frequency of urination, thirst, and frequency of, there is a thirst, frequency of increase your urination and increase your thirst, and there is a uric acid, glucose, what happened? Breakdown, increase your glucose level. If then you have the more glucose, kidney try to out the body defense try to out the remove the glucose, then more urination of the thirst. And in case of when you not take food, you feel not better. When you eat more food, you feel not better. Then you go to the glucose RBS, random blood sugar. RBS found 10 or 11. Then it is pre-diabetic condition or diabetic condition. Then you go to the test OGT, oral glucose tolerance test. There is some amount, amount of glucose given in your body for there is the amount of glucose you drinks. After drinks, your body system how much glucose metabolism there is a system. If fasting glucose is more than 7.8 and OGTT oral glucose after taking glucose, your OGTT test is taking glucose amount. There is a certain amount of glucose taken. By that certain amount of glucose taken, your blood sugar is found more than 11 equal more than 11, then you diagnose as a diabetic patient. But 10 to 11 by OGTT RBS, there is pre-diabetic condition, or either pre-diabetic condition. Without OGTT do not problem. But if you eat more sweet, glucose level normally can increase. If you not remain fasting, glucose level can reduce. By that policy, you can understand that by diet and by starvation 1 hour, 2 hour, 3 hour, when glucose level is more, by starvation 1 hour, 2 hour, 3 hour, reduce. After 3 hour starvation, you see that glucose level now coming 10 to 9. No need to do exercise. Then when comes 7, you take food. By that policy, without painkillers, how you survive. Now drug. Now in case of glucose level more than 10, you take a single drug, glucomate single 500 mg single tablet. When come to below 10, not taken by single drug. If you continue that, now single drug can control. Now without drug, you take 250 mg. When your glucose level remain 10, now 1 week you glucomate, after take glucomate, now 9 mg per dl or 9 mg millimole per liter. You take a single